on women and menopause. How did I get this experience? Quite simply, as a surgeon, I was never trained as an endocrinologist, but when I did the reconstructive surgery and the exenterations of surgery, I had to remove their bladder, uterus, and rectum. And one of the reasons that I found interesting was that the tissues that were not good if I did not prime them with hormones. The hormones gave them life, viability, elasticity, and I could do it. What was very interesting was that after a few years of having people from California come, one of the women said, "I'd like to have a year's prescription of what you gave me." And I said, "Why?" She said, "Because I can sleep for the first time in 20 years. So it made me think, oh my gosh, I'm working on the pelvis and it's affecting her brain. So this is my textbook that I wrote. This is the kind of surgery we did, and this is the kind of repair we had to have, and without hormones it could never be done. So another thing is that what we see is this typical look, and you can take your time and refer to this at your leisure. We have to move quickly to show you that the typical look of senior athletes, you could see the thyroid legs, you can see the volume of tissues. This is a younger girl, and you could see the bones. You see the typical osteoporosis look that you see every day. A twin study in which they show that a woman without estradiol and a sister with. This is a typical picture that you should think about. And you can look at this, and you could see the difference between the progesterone of 20,000 to 200 of estradiol in your prime. Later on, it dwindles down, and this is where all the problems start, okay? So basically, you're living, at least 2 times past your reproductive period, and hormones just don't change that much. This is a slide that I want you to take your time and really refer to, and I just want to tell you first, the hot flashes start, but the loss of sleep is very important. The weight gain, the mood swings, the thyroid changes, skin and vaginal tissue start changing as you change your state. Your bladder functions change. Of course, the libido changes, and later on you begin to see the bone loss, and of course, Alzheimer's becomes very important as the brain function is highly dependent on hormones. The risk of cancer is also there. So you take your time and take your time to study it. We already covered this, that there is a atrophy and a loss of the follicles as you age, and at age 48 there isn't much. The important thing to remember is that the corpus luteum makes progesterone, and without any ovaries it's not going to work. So that goes away quickly. And remember the PE ratio is 200 to 1. 20,000 to 200 is ideal. You don't have to be there, but in order for you to feel good, this is important. Sleep is our biggest problems in the clinic. All these other things follow. Take your time, and this is all related partly to hormones. Why do we think about progesterone as important? Because it affects the GABA receptors and makes you sleep. These are the 2 byproducts made by converted by the liver, and you should be aware that we use this often to make sure that we could use it to our greatest advantage. It's the highest sedative molecules with very little side effects. And typically, we see that the women who have a lot of breast disease have a low progesterone level, okay? Again, dense breast to normal breast, just using topical progesterone does it. We see this all the time. Dense breast, fibrocystic disease, thickening of the endometrium. And these are the things that we usually use to lessen the effect. This is typically Mariah Carey's story in which she could not get pregnant. As soon as gave her progesterone, she was able to have a pregnancy. So again, typically an imbalance. Fibroid uterus, a lot of problems with breast and endometriosis are also related to an imbalance of hormones. The endometrium, of course, will thicken when there's too much estradiol and will atrophy with progesterone. Bones, as you can see commonly, is affected by progesterone. And Donald Stein is one of my colleagues, and he was the one who suggested that the brain can be protected from trauma by the use of natural progesterone. Again, we're talking a lot about the kind of endogenous and human identical hormones. Cowan showed that the people who had less progesterone had a problem with higher risk for breast cancer. Again, I reiterate 200 to 1. So in the hormonal axis, we always look at hypothalamus, pituitary thyroid, thymus even, pancreas, adrenal, and the gonads. Natural progesterone has been studied many, many years, since 1950 by Catherine Dalton and others. But this is an important one that you should remember, because everybody tells you hormones are bad. It's because we're using horse hormone and synthetic hormones. And you could go over this at your leisure, but the most important thing is clots occur with synthetic hormones. Empower yourself, read things, and these are the two books that I recommend for you to read as a beginning way to look at it. You can get many different kinds of blood testing, and you could tell venous blood, blood spots, saliva, but you just remember one thing, that the liver will get rid of all the hormones and drugs by 90%. Thyroid is important because it's clearly affected by the estradiol. This is typically the thyroid look of the straight legs of myxedema. Any condition that causes high estradiol level will affect the thyroid, such as birth control pills. Your body temperature shows a basal metabolic rate, and ideally it should be closer to this, and people with hypothyroid have problems with it. People who eat a lot of raw vegetables will have trouble with thyroid, because this will affect their thyroid, like cabbage, Brussels sprouts, collard green, mustard. So we like it cooked rather than all raw. Bread, chloride, iodine all affect you in many different ways. Adrenal gland, if you're overstressed, will affect you. I recommend these two wonderful books. You will enjoy it very much to understand how the adrenal gland makes your life so difficult. There are many ways that you can look at this, but I left this slide for at your leisure. It's hard to explain it, but these are the things you can do to make life better.